Health officials say a doctor who recently returned to New York City after treating Ebola patients in West Africa has tested positive for the virus.
In the weeks and months leading up to our first active case of Ebola, we had many patients under investigation for Ebola. The day that we actually got our active case, by chance, we had a drill planned for that morning.
My pager went off, and it said that the drill was canceled. Disappointed, I went back to work. I was seeing patients in the clinic. A few minutes later, my pager went off yet again. This time it said that our activation of the command center was live. I thought this was really strange because they canceled the drill. It wasn't until I looked outside the windows in the clinic and I saw the line of reporters outside our hospital did I realize that something was up.
We began to enact our protocols. Everything we had trained for, practiced, talked about. Our team worked together, carried out all the plans that we had made in the months leading up to that, and we had a successful outcome.
Bellevue Hospital is the oldest hospital in the nation. Dates all the way back to 1736. And over the last 3 centuries, Bellevue has played an outsized role in every pandemic, every crisis that's hit New York City, from HIV/AIDS, Spanish flu, COVID-19, as well as Ebola.
Our mission is to deliver the highest quality compassionate care to all New Yorkers with dignity, respect, and a culture of inclusivity at the heart of everything we do, while adapting to the city's evolving public health needs.
Special pathogens cause high-consequence infectious diseases, or HCIDs. Responding to these HCIDs requires a heightened coordination between frontline healthcare staff, health systems, public health agencies, research partners, and regulatory agencies. They require enhanced infection control measures to prevent the spread of disease.
New York City is the hub of the world with nearly 20 million people living in the greater New York area, 150 million travelers coming in every year with 3 international airports, and of course, countless activities happening daily.
The city health department cannot provide clinical services, and what Bellevue does is very specialized. And over the years, there's really nobody else in the city that can provide the level of care that they do for these special pathogens. We have been working together since 2014 when we started preparing for the West Africa Ebola outbreak. Since then, we have pretty much worked together continuously on joint planning activities. We meet very regularly, at least twice a week, but we are in constant communication. It's really important that we have Bellevue to support access to care initiatives in terms of treatment, access, testing, and care.
We want to bring our expertise throughout the region. We train over 300 people a year. A lot of it is personal protective equipment, donning and doffing, and some of the processes and skills that they may have or need some insight to admit a patient, to discharge a patient, and to safely care for the patient, but making sure that we keep their staff safe also.
We were the first region in the US to create an active website that has all of our resources available for our partners. And these include partners in EMS, in healthcare, and in public health.
NYC, or the National Emerging Special Pathogens Training and Education Center, is a consortium between 3 major academic institutions in the US, New York City Health Hospitals Bellevue, Emory University, and Nebraska Medicine. These are the 3 institutions that took care of Ebola patients safely back in 2014 and 15. More recently, we have the exciting mandate from our funders to develop the National Special Pathogen System, and we are currently congressionally approved to be the coordinating body for the National Special Pathogen System of Care.
We work closely with local and international experts to maintain our awareness of current outbreaks of concern.
We firmly believe that outbreaks don't follow international boundaries, which is why we collaborate really closely with like-minded people across the globe. We have deep collaborations with colleagues in Toronto, in Canada, in Sub-Saharan Africa, but 2 really important advancements have been our memoranda of understanding with the Japan Institute of Health Security in Tokyo and with the National Medical Center in Seoul, South Korea. With our global partners, we advance our research initiatives. We work closely with them regarding outbreak readiness, as well as training, PPE, and surge capacity. We stand here at Bellevue on the shoulders of the giants that preceded us. We have a wonderfully passionate team that is brave and is prepared to go into any eventuality that might happen. And in the case of high consequence infectious diseases, we have a plan in place for whatever comes our way.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.